Hi, coming to you from CareWorks RN again. Just want to talk to you about falls. Falls are not a natural part of aging. Many times people say, oh, my mom is falling or my dad is falling and we're going to take her to the doctor. Well, it's not normal. There's something contributing to the fact that this person is starting to fall. And what we have to be very concerned about is falls are the leading cause of death in the elderly population. And so it's not just a fall anymore. It's a little bit more when you're talking about elderly people. And believe it or not, when we're talking about elderly, we're talking about those people who are 65 and above. All right, and so there are many fall risk assessments that you can take. A lot of them are just questionnaires. The CDC has one. We will post one for you to take yourself so that you can figure out whether or not you're even at risk for falls. But the most common injury that occurs from falls is fractures. And typically what happens is this: the person falls, they fracture the hip, they break or sprain something in the lower part of their body, and then they end up in a hospital to get a repair. Now, once they have a hip repaired or replaced, then usually they go to rehabilitation, such that they receive the necessary exercises in order to get their strength back. So stay with me. Now, once a person goes to rehab, then usually family members start to talk about, what can I do with mom? Or what can I do with dad? Is it safe for them to go back home? Well, the truth is this: you have to determine why that fall is occurring. Is the person having proper nutrition? Maybe they're skipping meals and getting weak. Maybe their blood pressure medication is not working well, where it causes this sudden drop in blood pressure and people get dizzy and they fall out. A host of contributing factors. But the main purpose of wanting you to understand how important it is to avoid falls is people want to age in place. If you think about yourself, you don't want to end up in the hospital, from the hospital go to rehab, and then your children come and tell you, oh, mom, or oh, dad, you're going to have to stay in this assisted living. That's how it usually starts. And then a couple of months down the road, then you find out they're not doing so well, and they go from assisted living to long-term care. So we want to try to avoid that as much as possible. So of course, that means fall prevention. So how can we prevent falls in the homes? So a couple of things to think about. You know those fancy throw rugs that most older people love? Get rid of them. The scatter rugs, the throw rugs. Either get rid of them or make certain that you have some sort of sticky tape that will secure them to the floor so they aren't moving. Make sure that if your loved one starts to have urgency to go to the bathroom, because many times the older we get, you don't necessarily get incontinent, but you might frequently have to get up to go to the bathroom a little more. And so when people have to get up in the middle of the night, sometimes they're not all of the way awake, or they're rushing. And, you know, I don't care how active you were at one point, that rushing can get you. And so therefore people will fall. So we want to make certain we get rid of the throw rugs or secure them. We want to make sure that people understand not to rush when they have to go to the bathroom. It might mean using some sort of incontinence brief, like a Depend or something like that, especially at nighttime, to help someone feel a little more secure. With shoes, don't walk barefoot. You know, make sure that they have non-skid slippers or non-skid shoes or non-skid socks. Something that's going to have a grip on the bottom, such that that will help prevent falls. Make sure they're current on their vision exams. If you wear glasses, and I've worn glasses for quite a bit of time as an adult, if you wake up in the middle of the night and you don't grab your glasses or don't have contact lenses, if you don't have proper lighting, it can be very challenging to navigate yourself around your own house. So make sure that they're having their vision exams. Make sure that you check your loved one's feet, the bottom of their foot, because many times, because of mobility problems, they can't put cross their leg and look at the bottom of their foot, because sometimes there could be an area there that is a little more sensitive and they're trying to avoid that sensitivity. Make sure that you're doing a check on the person's medications, that, those 7-day-a-week boxes work perfectly. Maybe once a week when you come over to visit your loved one, that you make sure that those boxes are filled. And go have someone be the advocate and go to the doctor with your loved one the older they get. Because sometimes medications change, or sometimes a person might not need as strong of a dose. Or sometimes you will find that people have gotten in the habit of taking something for sleep. Everybody thinks melatonin is so safe. Well, melatonin, it can be safe for many people, but it can also have some side effects. So you want to be careful of things like that. Pain meds, if they're taking anything to manage pain or allergies, many of those medications have side effects of some drowsiness. So take a look at the medications and look at either the insert or the label and see if any of those medications may be causing drowsiness, which could contribute to a fall as well. Okay, so remove clutter. Make sure, the older you get, you want to hold on to everything. You don't want people to take stuff away from you. Make sure that the room is not cluttered. However, I will tell you this, is that if you're going into your loved one's house and you're moving things around because you think this looks better, make certain they are there and they agree to it. And have them go around and check where you have now put items, because nothing is more frustrating and could lead to some level of confusion if people can't find what they need. So you want to make sure that if you decide that that box needs to be in the closet, then your older person is not going in the closet rummaging through this box trying to find something that you decided was less important and you packed it away. So main takeaway is that take care of your loved ones. They took care of us. Prevent falls as much as you possibly can, because you want to keep your person home as long as possible. You don't want them in facilities if you can possibly avoid that. So stay tuned. We will bring you a questionnaire that you can either do for yourself or have your loved one do it, and then take the results to their provider to see if maybe they are at a greater risk for falls and something else needs to be done in order to help them prevent falling. All right, see you next time.